Good afternoon, everyone. This week marks the 100th anniversary of the Rockefeller Foundation. My name is Michael Myers, and I have the honor of directing the Foundation's Centennial Program. So I have get to take the liberty to tell you a little bit about our history, and particularly in connection with digital health, the subject of the panel that is coming up here this afternoon. We're marking our anniversary as the Rockefeller Foundation, of course, by looking to our past, but even more than that, to look to the future with a sense of urgency and optimism about the things that can be accomplished in the next century, just as we have accomplished many things in the last century. So, for example, earlier this week, we announced that we're launching a competition to invite cities from around the world to apply to become part of a new global network of resilient cities that build up their resilience to shocks and stresses such as climate change and natural disasters. And we're building on our own history in creating this network because of work we've done with Asian cities over the last decade, the work we did in New Orleans following Katrina, and of course post-Sandy here in New York. So that's the kind of thing that we're doing, building on our past accomplishments, but really looking to the future. We're holding events around the world and other activities. We held an event in Beijing in January on health, dreaming the future of health. And we were delighted that people from GBCHealth could participate in that event in Beijing that brought together people from government, from the private sector, from academia, and so on to think about the things that can be done now to shape the future of health going into the next century. We have a long history in health, but particularly when it comes to digital health, we also have some pedigree there as well. But our foundational activities in health really started with our commitment to public health. And in fact, the Rockefeller Foundation is responsible for building that field in the United States and globally. We founded a school of public health that some of you may have heard about. This was in 1916, Johns Hopkins, the Bloomberg School of Public Health, the first one in the United States. And though some people from Harvard or Columbia may dispute it, it is said to be the top public health school today in this country. Science and technology have been a very big part of our health work over the years. We discovered a vaccine for yellow fever. We contributed to the development of penicillin. And we developed the whole field of molecular biology, and in fact coined the term in our own offices here in New York. Between the work of our own officers and the work of our grantees over the last century, we have received 221 Nobel Prizes. 71 of those were for work in medicine. Now, when it comes to the specific topic of today's panel, digital health, I'd like to share a couple of stories that speak to our background. A couple of my favorite stories about the history of the Rockefeller Foundation and health. In the early 1940s, we supported work at MIT to develop analog computers. The U.S. Navy supported that same research at MIT. They were interested in artillery ballistics. We were interested in analyzing heart rate patterns and saw the potential for that early technology, analog computers, to help in that regard. Another story, in 1956, we supported a conference at Dartmouth up in New Hampshire that brought together mathematicians and scientists and other experts, but they needed to coin a term for what they were talking about at this particular event because the term didn't exist. And they came up with the term, it's artificial intelligence. So we were responsible for the early beginnings of the development of artificial intelligence, and we see the interest in AI and robotics in healthcare even today. So, and then that leads to our work in more recent times on mobile health and the transformative power it has, as we'll hear from this panel, in shaping health outcomes and improving health systems and improving the quality of care worldwide. It's a very, very, very powerful tool. Now, on to our panel. Disruptive digital technology is evolving the traditional delivery of healthcare opening new market opportunities, and providing broader access to underserved populations. Our moderator, Dennis Gilhooley, has assembled today's panel, which will explore the promise and potential of digital health to accelerate global development goals in health and beyond. Dennis has engaged in ICT for development for over 30 years and is the founder and executive director of the Global Digital Health Initiative, a public-private partnership at the intersection of the ICT and pharmaceutical communities. So now, thank you for your patience and your attendance, and I turn things over to Dennis, who will introduce our panelists.
Well, good afternoon, ladies and gentlemen. Yeah, I'm Dennis Gilhooley, and I think we should say happy birthday to Rockefeller for 100 years. Remarkable. And that lexicon of breakthrough interventions in the health sector is quite remarkable. You've left out Mr. Kinsey, by the way, which is a great movie with one of my co-Irish people, Liam Neeson. And we have a rather bizarre panel today because Joanna Rubinstein is the only Swede on the panel. Everyone else has Irish heritage. We have a Grady, a McGee, a McGovern, and a Jordan. Believe it or not, Neil Jordan is the greatest film director in Ireland. He did The Crying Game, but this guy's from Microsoft, so, okay, not the same guy, just so you know. But I'm going to kick off immediately with Neil because Microsoft is a behemoth, as we know. Now, traditionally, GBCHealth has been, I'd say, probably more skewed towards pharmaceutical and, a broad multinational, rather than the ICT sector. But it's quite clear that this panel is about the future. The title of the panel is Digital Health, the Way to Global Development. And the answer really is yes, because we are now going to face absolutely total and extreme mayhem in the health sector in terms of spiraling costs as we move to aging populations and the pandemic of chronic non-communicable disease. Now, for anyone in the room, there was no MDG on chronic disease. The fact is, it was just forgotten. And it is still forgotten in the developing world, even though about 30% of the cases in the health system in most developing countries are actually attributable to NCDs. It's just forgotten because there is no money within the health budget. In the developed world, we're looking now at about 18% of public spending, government spending in the United States on the healthcare system. That equates to about 8 or 9% in Western Europe and about 0.1% to 2% in most of the developing countries. So you can see this sort of huge disparity in terms of what we're talking about. So one of the issues is that we have to focus the debate on individual countries. With the MDGs, the problem was that it was just blanket targets. And so Joanna and Jeff at Columbia and the Earth Institute and with the United Nations and with Ray Chambers is trying to figure out where the Sustainable Development Goals should go in this area. And Heather at Rockefeller has been one of the great advocates for universal health coverage, which we'll come to later in the panel. But Neil, where is Microsoft in the digital health space? And have you messed it up from the beginning? And where are you now?
I always like the fact that you can start these on a positive note.
I know. Well, it's an Irish thing.
So yeah, I know. It's definitely a British thing, isn't it?
It's a British thing too, actually.
Yeah, definitely.
Yeah, absolutely.
Thanks for the question, though. I'd say where we are is in some ways they're kind of the front row of the cheap seats. We're not a health specialist company. We're not trying to create specialist EMR products that are out there. We have some
electronic medical
records, electronic health records. We're trying to create innovation and platforms, and frankly sustainability as well, that enable an industry, whether it's in a resource-strong or resource-starved environment, that is super starved of information and is not using information in an optimal way today. And we do that through everything ranging from software to devices to clouds and so forth. Yeah. And I think it's been fascinating for me, particularly at the conference this week to look at the scale of innovation that's happening and how people are starting to do things not just as small projects and this problem of kind of rampant pilotitis that we see across the e-health world, but are starting to do things in a really substantive way, whether it's the work that Operation Smile's doing that I'm sure Bill will talk about, or whether it's the winner of the GBCHealth Technology Award, that they're just getting out there doing things quickly with our technology with other people's technology, and creating real impact and creating benefit really, really quickly. Microsoft's role in that is to provide software, provide devices, provide cloud computing resources, but also, I think from a philanthropic perspective, to hopefully provide a philanthropy of knowledge. The job I have feels like a kind of a privilege to talk to all the people that we get to talk to and help people understand and translate what's happening in all of the different environments, and share that information. And we project and open source a lot of the kind of learnings and the information that we get from that marketplace in the desire of trying to show that software can have a really significant impact in this world.
Yeah, no, we're clearly at a tipping point now. Smartphones, we haven't really come to grips with the enormity of the traffic loads that are going to be on global data networks now, and the carriers are having to come to terms with that, but also with the applications explosion. But we're seeing a number of mega trends. Clearly broadband is one, smart mobility is another, the cloud is another. There's 5 pillars as I see them. Yeah. Big data analytics, and then the last one would be social networking, obviously. Where are you in this convergence, this coalescence of mega trends? That's a big question.
That's a really big question. I don't really want to take each of them individually. I mean, I think analytics, certainly, something we've had a strength in for a while, and one of the great realizations, I think, these days, particularly in the US, with the advent of meaningful use, is that just putting an electronic medical record out there isn't going to solve all these problems. It's what you do with the data once you've collected it. And again, really interesting talking to the folks from North Star and Ortec Alliance, and having put these, I think it's 50, excuse me if I get it wrong, 53 or 43 roadside health and wellness clinics, they're suddenly getting a whole load of data out of them that's enabling them through the 260,000 or so transactions that they're getting, clinical transactions. They're being able to understand the epidemiology and the trends much better. So definitely analytics, cloud for sure. We've bet the whole company on the cloud. That's where we're pushing our work there, and I think we've done a lot of work, particularly in making people, or we're starting to do a lot of work in making people feel comfortable about putting patient data in the cloud. I'd say 2 years ago, everyone was, the cloud isn't for health, nobody's going to use it. But the massive advantages of scale that come out of it in a very fragmented system are really important.
It's viral networking, it's the networked effect, essentially. The more people that are connected to internet, the more powerful the network becomes.
Right. I just got back from a trip to Brazil, and Rio State were struggling to put in electronic medical records into their public hospitals. Not very well funded, not huge budgets, but catering for an incredibly important community there. And a Portuguese partner called Ongoing had put a cloud-based EMR across there that they deployed to 260 hospitals and clinics in under 3 months, and over 1 million patient records on it. And you compare that to the US model today, where you're seeing hospitals, in some cases, literally going bust as they're trying to deploy some of the more traditional models that are happening here. Yeah,
well, there's a great analogy, and if you go to the Presbyterian Hospital in New York City, or you walk into the NYU, there is absolutely no record of you anywhere in the system. Whereas in Sweden, or in France there's the carte santé, which means your entire medical history since birth is on one credit card, a smart card. And in Sweden, there's a lot of connectivity. And information is the lifeblood of health. So the system is broken in the United States. Is that going to be your primary market, or are you really going to invest in the developing world?
You know, we don't have the luxury of only having one primary market. It's certainly, if you look at it from a pure revenue perspective, there's huge market here, and it's not surprisingly. I think if you look at the overall money that's spent on health technology, 62% of it is spent in the US. So yeah, we'll work there, and we'll work in and around meaningful use and the stuff that's going on here. We will also try and bring a lot of the things that we see happening in other countries where they don't necessarily have quite so much luxury, and see how we can affect and transform things. So I mean, we are truly working globally. We have health businesses in pretty much all of the major countries that Microsoft works in.
Right, the advertisement. But look, you are a software company and you're behemoth. Now, we have a number of constituencies which are developing. They are the carriers.
Yeah.
Now, ultimately, the only people that are going to deliver this stuff, particularly for non-communicable disease, is going to be the carriers. They have to wire the homes with fiber optics. And the hype around mHealth, and you heard it yesterday, you hear it everywhere, and all the rest. We need an infrastructure behind the mobile networks. That is absolutely critical, particularly in Africa, for example. So the constituencies which are developing would be the traditional carriers, Verizon, AT&T, the new carriers, which is Google, for example. And I don't know whether anyone knows in the audience, but Google actually has its own infrastructure, a gigabit infrastructure, which Vintage Surf, our good friend, has sort of helped them construct. Then you have the social media players with Facebook and Twitter and all the rest. And then you have the traditional software players. So how is this going to play out?
It's going to be fascinating. So firstly,
it's chaos, isn't it?
I don't know if it's chaos. It's definitely that
Creative
point.
chaos?
I studied a lot of evolution at university, and at every evolutionary break, there's always a massive amount of diversity that happens around it. You know, you see all these beautiful evolutionary trees that look like it's incredibly clean, but actually at the point where there are massive changes happening, there's always huge diversity, and you see that in all the different shapes and form factors of devices that are around at the moment. So I don't think the diversity is a bad thing, or the chaos is necessarily a bad thing. I think what's difficult is people need to, it is useful to understand that whilst the infrastructure is really important, it doesn't need to be huge fat fiber optic pipes into every single hut. That's not what it's going to be about. It's about designing systems that are smart enough to manage and degrade well with different infrastructures that are out there. And we build a lot of that, and so do lots of other people, into their software. So we can work offline when there's no access to any type of IP or network of any sorts. But you can also make the benefit of it when there is one, and you want to do a teleconsult or
But essentially, Microsoft sees health as one of the great growth sectors for the company, with education moving forward.
Yeah,
which
and
I think
they're
Joanna made a comment to me a couple of weeks ago that education is probably about 3 years behind health in terms of figuring out where they should be and all the rest. But both of those public sectors need re-engineering in a radical way.
Right, there's a me who's responsible for our education business, and we talk a lot, and we often say there's no health without education, and there's no education without health. And you've
That's
got to
a good segue to the interlinkages between the MDGs. One of the problems with the MDGs was that they were siloed. So you had HIV in one corner, and the funding mechanisms developed for HIV were radical and brilliant and global, but they were just for HIV. And we're only now getting on board in terms of maternal and child health. So, Joanna, you run the Millennium Village projects with Jeff, and who's coming on after this panel. The holy grail of scalability and sustainability has proved rather elusive for most of the actors, particularly in multi-stakeholder partnerships. How can we actually move beyond this, particularly as we're looking at the post-2015 environment?
I think I would like to start, Dennis, by very quickly just explaining what the Millennium Villages are about.
Sure.
I know that many people in the room may know about Millennium Villages, but it's really a proof of concept project in 10 countries in sub-Saharan Africa, trying to prove that the Millennium Development Goals can be achieved with right investments in very basic things such as agriculture for food security, education, health, of course, and infrastructure. And trying to prove that if you have adequate investments and you really attack or address all the major challenges in health, looking at the health MDGs, you can help those even poorest communities in Africa to get on the track of sustainable development, economical growth. I think unlike what you said, Dennis, you said the MDGs were very siloed. They were not. They were very concrete in a way to show what are the things we need to address, how to do it. We are measuring the impact of the interventions on achieving the Millennium Development Goals, and they were meant actually as a holistic approach. I think it's more the institutions and the way how we are used to work that made them siloed. So in our experience, by really working on all the MDGs, we could see the synergies across the sectors. If you have children that go to school and have one meal per day, they are better off than kids that are working in the field and are hungry. It's no-brainer that health outcomes, if you also start to control malaria and the kids are immunized, are better than in the communities where you just focus on health interventions and maybe even on just one particular disease, which many of the NGOs do. Yeah. So I think what we have tried to prove is that if you engage and you really build a system in a systematic way that engages the local government, that engages the community, and brings those very basic interventions, you can promote the achievement of the MDGs.
Why Millennium Villages? Why not Millennium Countries?
You have to start somewhere. I think Millennium Villages were really to prove in a concrete way, can you translate the big plan of the Millennium Project that was launched 2005, which was really a roadmap how the different Millennium Development Goals can be achieved. Can you translate it into the local context? Can you actually do it? Not just talk about it and write reports or conduct research, but can you do it? And the project has been going on now for more than 7 years. Not everything is perfect, but we see great progress in those communities, and that becomes a great example for the local governments, but even for the federal government. You can go there and you actually see that the kids are healthier, that they go to school, that you have food, and the communities start business development as well. So it's really a very powerful, tangible example. At the same time, because we also have Columbia University engaged, you also have a way of engaging academic communities in studying how to really do this integrated development approach.
You've engaged very much with the private sector. Two of your key partners, Ericsson from Sweden and Novartis from Switzerland. And in fact, Klaus Leisinger, the head of the Novartis Foundation, is the co-chair of Digital Health Initiative, and Hans Vestberg's on the board, and they're all on the Broadband Commission as well. But how, as an academic institution, have you found working with the private sector?
I feel that in order to really be successful, you need all the stakeholders to be part of the project. And I feel that very often the engagement of the private sector is seen as private sector as a donor, provide in-kind resources or funding for the project. We have chosen the hard way of working with the private sector.
You got laughs in the audience.
We have many of the companies that were very lucky, or foundations that provide funding for the project. But I feel that more sustainable and more scalable activities working with the private sector are when we actually engage with the private sector. And we were very fortunate that the CEO of Ericsson already 2007 realized that this is a great opportunity even for the company to bring infrastructure to the villages where there wasn't a business case for the local provider to invest in heavy infrastructure, and to look how is that technology and connectivity going to transform those very, very poor communities and development in those communities. And the change that the mobile telephony has brought to those communities has been totally transformational. It's probably one of the most powerful tools for development, but one of the reasons also why it's because it's such a versatile tool that also lets us collect the data. For the first time ever, we can have more or less real-time information about through mobile phones.
Through GSM, yeah.
Yes.
Yeah.
And scalability. So you asked me about scalability. I think that especially using the mobile phones, we learned how the technology could be deployed to help us even manage the project, to do needs assessment studies. So a lot of the tools that were developed for the Millennium Villages, in 10 different countries, are now being deployed to help scale up the investments in MDGs, for example, in Nigeria, by using the same technology. So I feel that we haven't been just talking and working with the private sector in parallel, but we have been actually doing things.
It's a learning experience.
It's a learning experience for both sides. And I think that's what Ericsson values. So it's not the money they are investing. It's in infrastructure, but it's also having the chance of experience. What does it mean? How difficult is it to bring connectivity? How can it be used locally for business, and what are the right business models, and how to work with local community, but also with the governments.
So increasing the market will lead to more people being involved in the health system, essentially. and more connectivity to the health system in
I
general.
think we were extremely lucky, and then you mentioned Novartis. That was another very visionary partner that initially provided anti-malarial drugs Coartem to all the Millennium Villages sites, so we could actually experience what does it mean to have continued access to essential drugs for those communities, but also invested in research. So Novartis, without being themselves engaged in mHealth space, invested in building electronic medical records for the Millennium Villages. That's how we started the telemedicine project in a way. Then they invested and are investing now, one of the lead investors in community health worker programs and how to use mobile phones to enable community health workers in the Millennium Villages, and also how to link the two and how to create the telemedicine projects, which we are now doing in Ghana together with both Ericsson and Novartis Foundation for Sustainable Development.
When we talk about scale, what we're talking about is putting a mobile phone or a smartphone, which would be even better, in the hand of 1 million community health workers, are we not?
Exactly.
Because
I'm sure
that
Jeff
will
Sachs
be
is going to talk about
transformational.
it. Yes.
Yes.
It's both for education, it's a support tool, decision-making support tool. It's a tool to collect the data. You can even check your stockouts. But it's also, a tool for training community health workers. It's a really versatile tool. And with the smartphones now, you are less dependent on having continuous access to connectivity, and the cost has gone down all the time.
I'll come back to institutional inertia a little later, because the doctors are the guys stopping this stuff happening right now. They're scared out of their wits, because this is pure disintermediation. It's like putting an ATM on the corner, which completely messed up the banking system. That's probably the best analogy of where health is going now, because all of this is going to you. It's going to be personalized, and it's going to be ubiquitous. But Heather, as a foundation, now Rockefeller's, you've been around for a long time, and then suddenly the Gates Foundation arrives on the scene because Bill decides that he didn't want Microsoft. This is the real story of the Gates Foundation, by the way. He didn't want Microsoft to be broken up, so he had to spend some money, which is the reason for the foundation. How do you work in this space? Yeah, he's a businessman. How do you work in the space with this monolith, the Gates Foundation coming in now, and you were essentially the pioneers for the mHealth Alliance. I don't know whether really Rockefeller was behind the mHealth Alliance at the Bellagio meetings that they held, and it was one of the great outcomes. But how do you differentiate your interventions from where Gates is moving in terms of trying to dominate the whole environment?
Well,
sorry.
If I start by saying I think the challenge of health for all is big enough that many people can fit under that tent. So I would say we complement what Gates does, and there's an increasing number of foundations being established as we have more and more high net worth individuals, both in this country and around the world. And I think that many more foundations coming into the health space is a good thing. Yeah. Now, it's true, Gates is far larger than we are, far larger than anyone. But I do think that we all have our niche. And let me talk a little bit about how that mHealth Alliance got started. At the time, we partnered with Vodafone and with the UN Foundation. In the early days, which was really only a few years ago, in 2009, the first meeting at the GSM World Conference, I think it was a small room on the second floor of a conference center with about 75 people. Last year, 4,000 people were interested in the same topic. So that's the way a field can grow in a very short amount of time. Yeah. I'll give you another example of partnership in the whole field, and I'd like to talk a little bit about universal health coverage itself. But one aspect of this is also about logistics management. We haven't really talked about that, but how can we use technology to increase accountability? There's a lot of drugs in the system, and they're not all getting to the people who they need to get to. That supply chain for drugs is quite leaky. What do we do about that? Well, logistics management information systems is something that the Rockefeller Foundation is working on with the Gates Foundation, with USAID, with the NGO PATH, and others, looking at innovations in this area. So I think it's possible, as long as we're cognizant of our different sizes and what we bring to the table, that we can collaborate.
There has been evolution in the last few years of you working together around there. I mean, there was a competitive edge at the beginning, I think, but you are coming together now in terms of looking at the big picture. Is that a fair assessment?
Yes, and of course we did found together AGRA, the Alliance for a Green Revolution in Africa. That's an example of where Gates and Rockefeller came together. But I do think it's a field that needs a lot of people. If I can come back to universal health coverage,
Absolutely, yeah.
That's interesting because I think some foundations are looking at that more as foundations tend to take an interest in particular areas of expertise or where they have a passion. We do the same. This is a phenomenon in the philanthropic world. So we had the Millennium Development Goals, which focus on specific areas of health. But one of the things that the Rockefeller Foundation has felt, again from our 100-year history, is taking a systems approach to health problems. And one of the main problems in finding opportunities for health for all is the whole financing side. How do you actually create strong health systems where everyone can be covered? And that's why we took a different approach from specific MDGs and moved toward universal health coverage. That's access for everyone at an affordable price. And what that does is it looks at issues like risk pooling. How can you make a large enough risk pool that out-of-pocket expenditures for individual households are decreased? This has a huge impact on reducing poverty. It has a huge impact on utilization and access, and ultimately on all the same kinds of health impacts that individual MDGs are looking at. Right. Now, is that right and a single disease approach is wrong? No, I think they're complementary. But we certainly think that in the post-2015 framework, universal health coverage is a very powerful way forward.
What would you bet on the fact that universal health coverage becomes the sustainable development goal for health moving forward in the post-2015 environment?
We think it should be an overarching goal because it's an accelerator. It can be an accelerator and an umbrella for other goals. It doesn't mean that the other goals are unimportant, but we do think that this makes sense as an umbrella. I had an interesting meeting a week ago with many foundations that work on reproductive health issues. And we had a candid conversation about this. If we're promoting UHC, does that mean that reproductive issues aren't important? Absolutely not.
Right.
But we can't make enough progress on individual areas unless we really have a different conception of how we're going to get everyone covered and financed, and how we prevent people from using too much of their own household income for their own health benefits.
And it's worth stressing, universal health coverage has got nothing to do with insurance at all, has it really? I mean, it's going to be an element, but
in the
it'll be an
generic
element.
sense.
In the
it means
generic
everyone
sense.
is insured, whether it's a public payer.
It's health everywhere and
at an affordable price, yes.
Yeah, for all at an affordable
Yes.
price, which is a different dynamic. Okay.
And individual countries are constructing their systems in different ways. In some countries, there's already a single payer system. In other countries, in most countries, there's actually a mixed system of both public and private. I think we have to look, what's going to promote the greatest amount of equity?
Right.
What's going to get the broadest reach?
A lot of this has to do with payment and payback.
Yes.
So who's going to finance this and who's going to make money out of it?
Well, some of the financing for this is definitely going to come from the donor community and from philanthropy. Some of it is going to come from the fiscal system inside the country. There's a lot of countries experimenting with different systems. Some countries are using VAT tax, value-added tax. Some are using sin taxes, so tax on alcohol and tobacco. There's a variety of mechanisms.
Sin taxes, I like that one. It's not syntax, it's syntax.
That's right.
Okay.
And we have we've actually founded something called the Joint Learning Network, and that really focuses on universal health coverage, exchanging practitioner information across countries about what can work best, and comparing and contrasting the systems. If I can just add a bit about where digital health comes into this. As we ramp up government commitment to universal health coverage, there's obviously going to be an increase in demand. What about the supply? What about the information systems that need to back up those systems? Provider payment systems, that's a whole other realm. How do we make that work? We've already talked about how the systems are terribly inefficient, including in this country. There's an enormous opportunity as we roll out universal health coverage to marry that with much better digital systems of health information. And so really we see limitless possibilities. And again, partnering with other foundations and with the private sector and with governments on this has really been an important part of our strategy.
And you are front and center in the post-2015 debate, or you're trying to make an advocacy stance?
We are certainly working with a lot of different governments. Over 100 governments have reached out to the World Health Organization for support on universal health coverage and how we construct those systems. And I think most of those governments would agree this is very good as an accelerator for other health agendas.
Okay. Well, I left our two entrepreneurs until the end. We got Kevin here. Now, Kevin, he managed to get Pepsi-Cola and Coca-Cola in a bidding war for Sober, the soda company, and he ended up with $400 million out of it. And it went to Pepsi?
Pepsi.
It went to Pepsi, it didn't go to Coca-Cola. Who, by the way, Kevin sponsored the reception last night, so yeah, we'll keep that up. Okay. But you don't have to do what you're doing now. The water initiative, I think I described it as, the analogy was, you've gone from mainframe water distribution to a PC, distributed environment, where a unit can be in everyone's home, and there are quite radical health implications for sanitation for health. I mean, Jeff has made this point countlessly, that you can't do health without sanitation, without clean water. But can you give us a glimpse of, I should say, he managed to get, the chairman of his board is Quincy Jones, which isn't bad. That probably gets you a free pass in Hollywood. But can you give us a glimpse of where you are now with the water initiative?
If I can, I'd have to describe one thing in the past that relates to why I'm doing what I'm doing. One of the companies that I founded was KX Industries. And KX created the Pure filter for Procter & Gamble. And we also created the end-to-tap filter for Brita. And we created the first refrigerator filter for Electrolux. So bottom line, we were sort of a pioneer in in-home or point-of-use water. However, all of those devices, even to today, all they do is they make water taste better. They're not really as functional. They take out chlorine and lead, but they don't take out what I call the nasties, those being pathogens, bacteria, viruses, arsenic, fluoride. So when I founded the Water Initiative, it was take water to the next level of functionality. The water in New York is very different than the water in Nairobi, is very different than the water in Nepal. And so a silver bullet approach to water doesn't make any sense.
How bad is the water in New York?
I'm sorry?
How bad is the water
It's pretty
in
good.
New York?
Actually, we just completed a water index of the top 20 cities in the United States water and the worst 20 cities in the United States. And pretty soon you'll be calling into an app that we're preparing. By zip code, you can tell how the water is in your particular area.
You're not going to be very popular with the mayors, are you?
We're not here to be popular. We want to be effective. And what we're doing, we first went to Mexico, Dennis, and I went to the First Lady and I said, if we could bring a team of scientists from MIT, Cornell, et cetera, and we could go in and really solve your health problems, the number one cause of death in Mexico is diabetes. Of course, they don't drink the water. They drink Pepsi, Coke, and sugar beverages. So we went into Mexico, and they have the four major challenges. They have virus, they have bacteria, they have arsenic and fluoride. And I'm proud to tell you that the national government of Mexico now is rolling out a program because of the success that we've achieved, and now they endorse our products, the only endorsement for point-of-use products in the country of Mexico.
So
and we have
your
solutions.
Key markets are in your key markets are in Latin America. I know you're
We
involved
start
in
now
Saudi
in Latin
Arabia.
America. We're in Mexico, Peru, Venezuela, Colombia. We're in Saudi Arabia, and now we're hoping to launch in Africa.
Absolutely.
So we're taking country by country. And most importantly, I want to get this across, is what we do first is diagnose. We do not walk in with a product. We walk in with a team. We create a water map. And by that, you need to know what the issues are before you can come up with the solutions. And as I said, every country is different. So we create a water map of that country, and then we develop systems that work in that country. And then we find the partners who help us distribute it, whether it's the municipalities, retail, it would be entrepreneurs, et cetera. So we're really the 3 Ds is diagnosis, develop, and then deploy.
Yeah. I know you've been talking to Ray about how you might be able to work together to scale. So Operation Smile, I'm sure you all know what this is, but it's an inspirational initiative for kids in terms of cleft palates and defects. And your interventions, I think it's 3.5 million you made, Bill.
We've operated on about 200,000 children now, about 5,000 medical volunteers, and we'll put out about 170
So you're a
missions this
plastic
year.
surgeon, so yeah. Can you describe the initiative and
Sure,
why you came to it?
I can tell you
Because
that
you could be making money in Hollywood. You study with the best plastic surgeon in Paris, and you don't have to do this either, do you?
bottom line is I'm a very, very strong believer that reason leads to conclusions, but it's emotion that leads to action. And so, having spent 17 years in school after high school before I went into practice, you obviously have an academic background. But the reality is until you're touched emotionally, you're not really directed and focused.
Yeah.
And when my wife and I first went to the Philippines 30 years ago,
And Kathleen's in the audience.
yeah, she's really the reason it works. And, and it was really amazing because we took care of 40 kids, watched over 250 get sent away, and every one of those parents tugging at our sleeve, begging us to take care of their child, and we couldn't. And tears are running down their cheeks, tears are running down our cheeks, and nobody's going to come back. And Kath and I said, why don't we get a group of our friends? That's exactly how it started. Our friends told their friends told their friends, and where we are today. But I think that what we can add, if you would, to the technology thing is partnerships with people like Microsoft.
What are you doing with Microsoft?
Because we've been trying for years to get a medical record system that's not the medical record system that you would put in a hospital or anything, but it's a medical record system that we could bring into the field, where we could have tablets, where we could gather the important and integral information, where we could find out about the nutrition, where we could find out about the families, the genetics, the nutrition, the smoking, the alcohol use, et cetera, et cetera. But then we have to gather it, then we have to collate it, then we have to upload it to a server, then we have to get it back to be able to study it, and yet the volume is huge. So if we can do that effectively, we can study things that most people will never be able to study. And so I think that's huge.
So this is really data in action.
But not only that, if we have the ability to use the electronic system properly, think of the fundraising that you can do by putting the emotion into the fundraising to be able to support a charity. I can tell you that we raised about $6 million last year just on the social media and out of the website. And the people that give on the website give 40% more than the people who do it by mail. And you think, well, it's just the young kids, but 40% of those people are baby boomers who want to give only on the website. So the integration of technology into a nonprofit is massive, and it's huge. And it's the way of the future. So it's the way of the future for academic studies, it's the way of the future for raising money, and ultimately for taking care of more kids. And I think a child is the only language that each of us have in common. Medicine is definitely a powerful vehicle. And I think if you have the ability to combine those two, you have the ability to unite nations and people. If we can do that, then we're open to the communities we go into through the child that we take care of, through the before and the after, so people can say the involvement creates change. And through that, we can enter into the nutrition, we can enter into the genetics, we can enter into all a myriad of diseases that you need trust and relationships.
We're looking at a massive power shift with digital, where Facebook is now, we're looking at networks as nations, essentially. And we're still going to have to come to terms with this. The Google population, for example, Gmail is now about 500 million people. Facebook's 1 billion, as we know. But I don't think I heard the talk yesterday on social media. I couldn't understand a word of it. I think it was complete gobbledygook because nobody really knows what's going on right now. I mean, that's my view. But Neil and I have been here before. I feel right now we're at, as I say, a tipping point in technology with the smartphone revolution, just like we were when the internet actually happened in 1995. And it's a brilliant time because we're all trying to fathom where we're going. But Heather, I'm from the philanthropy point of view, and then from the Columbia point of view, how is social media going to impact where you're going?
Well, I think in the past, the way we produced information for our constituencies was these big paper reports. Now, don't get me wrong, we have 6 books coming out this year celebrating the history of our philanthropy, and they're wonderful to have on our coffee tables and in our offices and giving us gifts. But really, we are reaching
Some of us still like paper. We
We
grew up
do.
with it. You know?
But we're reaching tens of thousands of people through our social media, and that's something that we've really only gotten stronger on in the last year or two. But I want to mention, just related to that, just a week ago, we launched a new initiative, $83 million, 7-year initiative called Digital Jobs Africa. Very proud to be a supporter of this. We've been testing this pilot for the last couple of years in Africa. We launched it at the World Economic Forum in Cape Town on May 9th. And the whole idea is that there's a youth bulge in Africa. I'm sure most of us know that. What we do with all these many disadvantaged, but many high potential young people who don't have access to jobs. And a lot of the investment in Africa is in capital intensive, low job creation. This is in the service sector. At the same time, the ICT sector has to be the platform for the way that the economy develops in Africa. So matching the supply of young people who are hungry to get a good job, the need for the economy to have skilled young people to work in the ICT sector is incredible. And so just thinking about health in itself, so many jobs that can be filled in the health sector, to say nothing of banking and telecoms and even global supply chains. If we're talking about fairly traded goods, someone at the point of origin is going to have to enter some data about how that product was made. So we just see an enormous potential. We're very happy that we've had a part in this new initiative.
Yeah, and it's a $100 million initiative, actually.
$83 million, and it may grow. And that's just what we're putting in. We're fully expecting a lot of others to come in, including companies. We've been talking to Microsoft and Accenture and Cisco and many other companies about this work, because that's where the jobs will be, mostly in the private sector.
Joanna, and then Neil, you probably want to add to this, and then we'll go to the floor. So.
I would like to follow up on Heather regarding the importance of job creation, and especially in Africa, recognizing that one of the major challenges is also lack of the access to education, especially secondary education. We also know that a lot of poor health is also very much related to the gender issue and the fact that it's mostly girls that don't get access to education. So together with Ericsson, once again building on the technology, having learned what we can use mobile phones for health and connecting the schools, we decided and launched a couple of years ago Connect to Learn initiative, which is really about how to provide access to secondary school for girls by providing scholarships, but also at the same time connecting the schools, which gives those girls a platform. You know, they learn how to work with the ICT platform, which of course makes them then employable. And we all know that the woman who actually earns a salary invests most of it, more than 70%, into her household and her family, whereas men only 30% or 40% in best case, which means that this is the best investment for the government. Believe it or not, it's very hard to mobilize funding for that project. So I'm very happy to hear that Rockefeller recognizes the need for employing youth. But we also have to mobilize resources and engage the private sector in strengthening education sector, because it is going to be the private sector that will suffer not having educated workforce that knows how to use the ICTs.
Yeah, there is a huge gap in terms of human capacity in moving forward. Neil, quick remark, and then we will move to the Q&A.
We're certainly looking to see how we can close the gap, for sure.
Yeah.
And we should definitely go to the floor, and we should check our stories on how the Gates Foundation was founded, because I think we've got some different ideas about that.
I was there at the time. It was like, I was.
Can I just mention, what people, it's amazing how little people know about the water they drink. I was in
Ghana.
Ghana.
Back to water, hang on. All right, okay. All right.
It's amazing.
Yeah.
What social networking and social marketing, what we're going to be using it for this year is just make people aware of how bad it is, in terms of not trying to scare them, but educate them as to how they best can safeguard their health through drinking and cooking and having good food and good beverages intake in their body. It's very, very important.
Absolutely.
So that's very much part of the digital health issue in water.
Yeah. No, absolutely. And but the whole point of this conference is broader than one specific topic area, and that's been the evolution of GBC from AIDS to the broader environment now. I'd like to
Dennis,
go
just
to
before
questions.
you open it up.
You have to.
Speaking of education, I have to fly out to the West Coast for
She's
my
going-
daughter's college
she's
graduation.
She's going to Portland. She's going to Portland for
If I miss the flight, I'm in big trouble.
something's more important, so you can go now. Yeah.
Thank you.
Thank you, Heather.
Congratulations.
Thanks. Yeah, Neil, that was a subjective view on how the Gates Foundation came about, but we'll argue about it afterwards somewhere, right? Is there a microphone anywhere? Some questions? If you can state your affiliation.
Hi, my name is Jan Edwards, and I have a startup company called Paving the Way, and we're bringing mobile and tablet applications to Africa. And so being a startup, and I'm sure there's a few of us here, what would be your suggestions as to how we go about having conversations with large and medium-sized companies, because we're all playing the same game to make a difference globally for health and education? What would be your suggestions or rounds for us to have conversations with companies such as yours or others?
Okay, we'll take 3 questions. Is there another question? Is there a hand? Yeah, there's one there, and the gentleman over there.
Hi, David Gulliver with Raven Martin. Not a question, a comment. I just want to assure, as a New Yorker, I feel obliged to assure everyone in the room that actually we have excellent drinking water. It's from the Catskill Mountains. It's unfiltered, which is a good thing, and it's perfectly safe to drink.
That was it. Okay, right. Is there another,
Almost as good as
another
Seattle.
one? Do you want to address the question from the? Do you want to address the question?
Yeah. I always have advice for young entrepreneurs like yourself. Make sure when you're dealing with experienced people that you have other people who are experienced on your team. And so I always use the expression, have people who are reasoned and seasoned in your team, whether on your board or otherwise. When you go into another country, make sure you have indigenous people at the table with you who understand the cultural issues as well as the business and economic issues. Extremely important. So bulk up on your team on a part-time basis, virtual basis, whatever, but don't go it on your own.
Yeah, but you need some crazies too, don't you? Kevin?
Sorry?
You need some crazies too, right?
Don't get, well, she's fine. The entrepreneur's the crazy. What you want to have is people to complement the crazy.
Okay. Any other questions? Oh, do you want to? Yeah, go.
I think from a CSR perspective, whether it's Microsoft or whether it's any of the other organizations that have been mentioned today, most of them have got really good sites and pretty self-explanatory ways of how you get hold of what they can give. I think back to the point about what is CSR and what's philanthropy. Think more. It's pretty easy for us to give software. We do that a lot. We're okay at giving money. There's a lot of other stuff that's actually much more valuable, whether it's connections, whether it's experience, and so thinking about that side of the philanthropy is incredibly important as well. And from a technological perspective, I would say, I've said it 50 times already, but nobody's buying servers any longer. It's all happening with the cloud. From a technological perspective, you've got to look at devices that are going to be robust and priced right for the marketplace. And whether that's, everyone's been talking about smartphones. They're great, and we and other people are working on how can we get a smartphone that's at the right price point for the kind of markets that we're talking about. Yeah. But also don't forget the old, humble, dumb phone. Yes. It's amazing what you can do with these devices, how robust they are, the kind of battery life. And there's an organization called Robertson Technologies, which does a lot of work with what they call smart healthcare on dumb phones. And you can do a lot with those kind of devices as well. So think about basic technology as well as the latest, greatest stuff that we're all kind of sporting.
The other thing that I would suggest to you is that tell a story about one person that you've impacted. There's a great study that was done by UNICEF or somebody was trying to figure out how to raise money, and they said, there's 2 million people or whatever, some astronomical number of people that only eat one meal a day or are starving or whatever it is. And they did a fundraising drive on that, and then they did a fundraising drive on one child that was starving and couldn't eat, and far and away the one child outdrew the millions. Because you've got to feel that you can make a difference. Yeah. And it's that emotional connection that you're making that will help you to get in the door and talk to the people you want to talk to.
And here's a crazy idea. Big corporations like Microsoft are actually full of people. And people also make personal decisions about how they're going to give, and a lot of these companies have great matching programs as well, so that when they choose to give, and it's amazing how that can scale up. If you start getting to large organizations and get a lot of people spreading that internally, they can actually be really impactful.
Heather actually made a great point. There isn't a subtext of philanthropy. I mean, there are many, many new millionaires and billionaires coming onto the scene now, from the ICT sector particularly.
Yep.
And we need to try and coordinate them into the health space, because she made the point that, you know, if you start a foundation, you have to give 5% of this away every year, but they don't really know what they should be giving it to. So this is a project to coordinate the new philanthropy from the ICT community in terms of broadening the distribution base. Yeah. Joanna, I want to, before that, Neil, where does Nokia fit in now to the... Do you have a relationship with Nokia?
Yeah.
How does that fit into your health?
Well, they're making great devices, and they're making great devices at lots of different price points.
But are you looking at specific health applications moving forward?
Yeah, absolutely.
Elaborate.
I'd love to elaborate when I can. I kind of want to show them to you when they're ready.
You're being
to
too Microsoft. What's going on?
No, I mean, it's not a surprise. But when you think about the kind of applications that you get on phones that are, or tablets that are, you know, my email, my Facebook application, why would one of those not be my health? Why would that not be a hub for all of your health information?
I guess the last question, do you see a sort of a new paradigm for strategic relationships or partnerships moving forward in the health space? Do you think we're moving into a different type of area where we're going to have to work together in a much more compelling way?
We've got to be collaborative. I mean, I don't think anybody would argue that any organization is big enough on its own to fix these things. And I think the cause is of such importance from a systemic and from a personal basis, to Bill's point, that it causes individuals to break down some of their initial reactions to working with people who might be seen as their competitors, and allows us to work more collaboratively. And we certainly do that as much and as openly as we can.
Yeah, I know, a quick comment, and then I'll
Just
have to
wanted
wrap
to
up.
make a quick comment that we need to keep in mind that this is really enabling technology, but it doesn't really solve the problems. It's the way how it's going to be used. And it's a perfect platform for integration of information. It's a perfect tool for managing the information and managing the system as well. So when small NGOs or smaller companies are trying to penetrate new markets, I think they should be keeping in mind and have very clear objectives what it is they want to accomplish. Is it implementing a project that's going to be affordable and scalable and can have a global impact or national impact? Or is it just going to be a project that is going to help and change lives of a smaller number of individuals, but it's not going to have the same impact? I think having that vision from the beginning and understanding even what it is you want to change and how you want to get out of that space, an exit strategy is important.
And let me add a further thing to that, which is that it's easy to look at the systemic benefit of what you're going to do, right? Here's the systemic benefit of reducing the number of people who are suffering from any chronic disease, for example, in a country. Yeah. What people are, I have seen too many times happen is people don't think about the personal benefit of the people who are going to use the systems. Whether that's the consumers, whether that's the doctors, whether that's the administrators. If you don't think about how you provide them benefit in the moment, at the time that they're using the system, it will not get used, it will not get adopted, and we'll all be back to square one. And I've seen too many projects go down that route. So always think about the personal benefit of the people using the system first. The systemic benefit is absolutely going to come.
Absolutely. The NHS system where they threw away £20 billion is one.
As they said to me the other day, we only threw away $4 billion.
Oh, I'm sorry. Oh, I missed that one. Okay.
Dennis, just to give you one example, our biggest partner in Colombia and in Peru is the provider of the largest provider of healthcare services. They brought us in for preventive medicine. So they're our biggest partner. So the collision and the coordination is just right on.
Yeah, we've touched on a lot of subjects. This is a huge area now, and it's very complex, but it's in flux, but it is the future. So I think GBC is looking towards this space in terms of next year and expanding the debate and the discussion. I just say that in September, around the General Assembly, Joanna and Jeff and I are working on a specific meeting on digital innovation and investment, which GBCHealth will be a partner. with, and that's really trying to put science, technology, and innovation on the post-2015 agenda. And it needs to be put on because it wasn't mainstreamed in the MDGs in the first place, and it has to be mainstreamed in the development agenda, which is really going to be for about 15 to 20 years. This is a big deal. We have to really figure this out very quickly. I'd also say it's been an absolute joy to work with the GBCHealth staff, with Beth and Mike and Rochelle, and they got me organized in a way I'm not usually organized for these panels. So could you give a round of applause to our speakers?